Hi everyone, my name is Brooke and I am here as a part of the Invizi team today and welcome to our Q&A session. So today we'll be chatting with the lovely Rachel, who is our continence nurse, and we'll be going through some incontinence related questions that have been sent through by real customers. So we thank everyone for sending those questions through. And we'll try to go through as many as we can. So, just for our viewers, this is a part of a two-part series. So, this is the first part that you're watching. And in this video, we'll be going through more common and general questions in relation to incontinence and bladder health. And in part two, we'll be diving in a little deeper and going through more specific questions that go through things like medications, treatments, and particular health matters as well. So, first, I'd love to give a warm welcome to Rachel. And can you just tell us a bit about yourself and what you do?
Sure. Thanks, Brooke. So my name's Rachel. Hello from Sydney, Australia. I'm a registered nurse and I've specialised after a while, found my love and my passion for continence, which is really a gateway to helping people with their whole life, not just bowel and bladder issues, because we all know that those things affect everything.
Mhm.
So I work at a major hospital 2 days a week as a continence nurse specialist, running a clinic with the Urogyne team. I also run an enuresis clinic, so I see a lot of women and children in that clinic, and I also work privately as well for myself with my own nursing business, and I visit people in their homes, helping out with a lot of continence needs and other nursing requirements as well.
Mhm.
So thanks for having me, Brooke.
Perfect. All right. So we're going to get started with our questions, just diving straight into it. So to begin with, one of our first questions that we received was, I suffer from daytime and nighttime leaks. What products would you recommend for the different times?
Sure. All right. So probably the first thing to work out is how bad is your incontinence and what do you need to help make life a little bit easier while you're living with it. Okay, a lot of products out there that you can use. There are lots of disposable products, which you're probably most familiar with, things that you can pop on as a full pant or liners that you can put into underwear. There are a couple of extra little things that are helpful to know about if your incontinence is really bad. If you're a male and you're finding your incontinence is just getting out of control, you've tried everything you can and you've had your specialist reviews, there are things like Uridomes that you can wear where you attach to drainage bags. That's a male product that can be used during the day and night time. And for women, there's a product that's out there which is it's got a very low volume of suction on it, and it's a little bit like a banana that you pop between your legs, and that can help with wicking urine away from the skin as well. They get a little bit more, complex depending on what your needs are. So if we're talking about things that are simple, we've got disposable products. We've also got washable products that you can reuse. So there are quite a few companies out there now that are seeing the benefit in making wearable, washable incontinence pads that you can reuse. Just makes you feel a little bit more like yourself when you can wear something that's like clothing and not so much like wearing a nappy. So that can be a really helpful alternative. So in terms of daytime to nighttime, we're really looking at the capacity that you're leaking. Some people have more leaking during the day, and some people actually have more leaking at night. Probably the first thing to do is really get a good assessment, work out exactly what's going on with your incontinence, why you're leaking and how much you're leaking, and then see what we can do to actually make it a little bit better. Just get out there, start asking questions, get in contact with Brooke's team, or some of the distributors of incontinence products. And quite often, if you pick up the phone, give them a call, they'll be able to give you some advice as well.
Awesome. So I guess following on from that question, another one that we have was when I'm out, I have a large loss of urine. I wonder, especially at night, if I should be using plastic pants too, or waterproof bedsheet, or perhaps a combination of both.
Yeah, so this is a question that's probably quite a common experience for a lot of people that have got incontinence. And I'd say the first thing that we want to do is work out how we can contain your incontinence in a way that gives you some dignity, but also helps you with your hygiene at home and your own personal hygiene. Then the next thing we want to do is just take really good care of your skin. Because we know that urine can be quite harmful to the skin and that it damages it quite quickly. It's got a different pH to your normal skin, your skin's mantle, so it can start to damage quite quickly. We need to look after your skin as well. So a good quality incontinence pad, a disposable one, is going to keep that urine off your skin, keep you dry for longer, and then changing your pads in a timely way. And that means changing it when it needs changing. So changing it just as you're noticing it's starting to feel wet on the skin. You will learn in your own routine, how frequently pad changes should be for you. We don't tend to, say when pads should be changed in terms of timing, but we say, when your pad needs to be changed, change it when it's wet, because we want to protect your skin. So in terms of plastic pants and waterproof bed sheets and combinations of those, really it's about considering those things first. If you've got plastic products, your skin doesn't breathe as well through them. So if you're using a combination, just think about how your skin's faring. And then, at the bottom of everything, get yourself a good assessment, get in contact with someone that really knows what they're talking about.
So we have another nighttime related question. So it was, I have urine incontinence and I wake up 2 to 3 times a night to go to the toilet. How best can I reduce toilet visits at night?
This is one of my more favorite questions because the backstory to this can be really quite complex. We do know that if you're up once a night to have a wee, we call that normal. Any more than once a night to wake to have a wee, we would say that's nocturnal enuresis. You have to get up to wee. How can you best reduce trips to the toilet at night? All right, so we want to know why you're incontinent, why you're actually having leaking. And if you're not leaking, you've just got a frequency to go. We want to know why your bladder is actually telling you to go a bit more often than it should. So why is your bladder a bit unhappy? A lot of reasons why that can be. It might be medication that you're taking. It could be something that you're putting into your bladder. Fizzy drinks, caffeinated drinks, really sugary things. It might be that you're actually not drinking very much water and your bladder itself is dehydrated, or what's in your bladder is a bit mucky and murky and your bladder just really wants to get rid of it. When your bladder doesn't like what's in there, well, the lining of it's irritated, has these big contractions to try and push out what's in your bladder. And that's when you get that really strong urge that you need to go. So what's the best way to reduce toilet visits at night? We want to work out what's going on with your bladder. And that means talking to someone that really understands the body. The other thing that might be happening is you could be drinking a little bit too close to when you're falling asleep. So when we go to sleep, our brain releases a hormone that tells our kidneys just to shut down a factory overnight. If you're drinking a lot just before you go to sleep, or if you're not really sleeping very well. So if your sleep's a bit disturbed, you're getting up because the cat's climbing all over you, or your husband's a big snorer or something like that, your body's waking up a bit. And that's when your kidneys go, oh, we're awake now. Yawn and stretch. I think we'll make a bit more wee. And before you know it, you're up to the toilet. So we've got to work out, are you getting up to go to the toilet to wee? Or, is your bladder waking you up? Or is something else waking you up and you're just going to the toilet because you're awake? So that's often a helpful thing to know as well. So looking after your sleep hygiene, that can be a really helpful thing too. So maybe try and stop drinking a bit earlier into the evening, making sure that you're hydrating well during the day. Having glasses of water in the morning is often a good habit to get into. And then get yourself an assessment and work out what's really going on with that bladder.
Yeah, awesome. I can see how the cat and the husband could be a factor.
Yeah. Yeah. I think if we did a questionnaire on what wakes you up at night, is it your bladder? A lot of people would say, no, it's my cat.
Well, I guess leading on from the husband thing, we do have a husband related question here. So this question asks, my husband's incontinence has increased. He fortunately doesn't wet the bed, but when he tries to go to the toilet, his pajamas or track pants are already wet. As he tries to remove his PJs or track pants, he wets the floor and his pants even more. Do you have any advice?
Yeah, for sure. Well, first of all, we want to make sure that your husband stays safe and doesn't have a fall over
Mhm.
while he's trying to take his clothing off. Sounds to me like he might have a little bit of an overactive bladder that's telling him that he needs to wee a bit faster than maybe he'd like. Bit of that urgency to go.
Mhm.
So when it comes to clothing, sometimes it's helpful. I mean, it'd be really good to know a lot more about this situation as well, if there's any disability involved, anything like that. And that's where a really good continence assessment can come in as well. But if it comes to clothing, there are actually some clever things that can be done with clothing. You can get things that are a lot quicker to take off, a lot easier to remove. Um, Track pants and pajamas, having something that's easily accessible if he avoids standing up. Might just be about having clothing that's easy for him
Mhm.
to take off and put on.
Yeah.
Um, so reading the question again, he doesn't wet the bed, but when he goes to the toilet, his pajamas or track pants are already wet. So there might be an element of him having a bit of a wee and not knowing that he needed to, or not knowing that he'd actually already had a wee.
Mhm.
And that's something that takes a little bit more of a deeper dive into to work out, is your brain getting the messages up and
Mhm.
down the neural pathways to make sure that we understand that your bladder's behaving the way that it should, and it's getting the messages when it should, so that you can get that readiness to go, oh yeah, feel like I need to go. I'll take myself to the toilet, remove my clothing, and then I will relax my pelvic floor and let myself have a wee. Sometimes that pattern, that mode of action doesn't really happen the way that it used to. We
Mhm.
need to work out what's going on there.
Mhm.
So it happens practically every day and a few times a day. So yeah, I think probably the best advice is now it's time for you to get a bit of continence support. Um, and sometimes it can be helpful to practice a little bit of time toileting. So maybe every 3 to 4 hours, depending on how much you're drinking in a day, might be a good idea just to go, oh, it's probably a good time for me to go, have a wee, empty my bladder. And then that helps to reduce that sense of urgency that you have as well.
So I guess my question for you would be, is this a common experience? And I ask this because we get a lot of questions kind of similar to this, where it's like, okay, I don't have the urge to go to the toilet until I am there. So is this something that is common and you hear a lot about?
Yeah, for sure. I mean, that's a pretty typical description of an overactive bladder.
Hmm.
And that happens when your bladder has this need to get rid of what's inside a lot sooner than maybe you would like it to. So the bladder normally starts off about the size of your fist when it's empty, and it fills up to a capacity of about, I don't know, 450 mils when it's really full. And those stretch receptors go off and they send a message up through your nerves up to your brain, tell you that you need to go. And bladder might have these really hard squeezes. And that's when you get that really fast, really strong urge to go, like, oh, I'm busting and I can't hold it. I've got to rush to the toilet. If you're somebody that's a little bit slower on your legs, you're more likely to have a fall on the way to the toilet if you're hurrying as well.
Yeah.
So, main goal is to really try and calm that bladder down. Work out why it's so cranky and irritated. Might have something to do with those nerves, or it might have something to do with what's going on in the bladder,
Mhm.
or it might even be something like your bowel. So it's pretty common to have the symptoms of an overactive bladder. But I know reading the questions prior to this, Brooke, that we're actually going to get to a couple of those strategies later on as well. So that's good.
So we're now going to move into more product related style questions. So finding out what isn't working for you and what might help, or what products might be useful in certain situations. So first off, when should I change from a pull-up pant to a slip?
So the difference between pull-ups and slips, here in Australia, we call a slip an all-in-one or a wraparound. It's a little bit more like a nappy that's got the tabs on the sides that you pull over. All-in-one pads can be really helpful in that they've often got a much higher capacity, so they'll hold a lot more urine. you can get pull-ups that hold nearly 4 liters of fluid. So it can be quite a high capacity. Sorry, the all-in-ones. The pull-up pads tend to be a bit of a lower capacity, maybe 2.5 liters, 2 liters. So an all-in-one is helpful if you've got a lot of leakage and a lot of urine output for whatever reason, which I'd suggest having a good assessment for that too. But if you're having trouble containing it, often all-in-ones are better at night because they are, or the slips, they're better to fit when you're lying down. You can adjust the tabs so that it's a closer fit for you, so you're less likely to leak if you're sleeping on your side, especially for males as well. But they can be really quite bulky and quite difficult to wear if you're out and about. So pull-up pants are a bit more like wearing underwear, and a slip's just giving you a bit more control, but they're a little bit more fiddly and probably not something that's that easy to wear out and about as well. So when would you change from a pull-up to a slip? I'd say if you're having trouble with containment, or if you've got a real issue with actually getting a piece of clothing on like that, if you have to bend down to get your legs through the holes to pull the pant up, you might find it easy to actually put a slip on or all-in-one for yourself. Yeah.
Mm-hmm. So our next question is, I have a permanent catheter which bypasses frequently. It is replaced by the community nurses, but still keeps happening. Any reasons why this happens?
And thank you for that question, because I really feel for you in this one, because it can be really quite distressing when you've been through the process of actually getting a catheter put in. I'm assuming that it's a suprapubic catheter, so one that goes straight into the bladder through your belly. We do get bypassing with the indwelling catheters as well. They're the ones that go between your legs through the urethra. Sometimes there's just absolutely nothing we can do. We troubleshoot everything, and you're just one of those people that has a leaky catheter. But before we decide that that's the case for you, we want to make sure we've done those troubleshooting. So sometimes catheters will block because you might have really strong bladder spasms. So it's one of those ones I was talking about before, where the internal pressure of your bladder the force is so strong on the urine that it just will force it out through the path of least resistance. So if it doesn't go through the holes, it'll bypass down the catheter tube on the outside of it. You might leak that way. Leaking is far more likely if you're constipated as well, and you're likely to have a leak if you've got a blocked catheter. So why is your catheter blocking? Well, maybe you've got too much of that murky stuff inside your bladder, and we really need you to drink lots more water to flush your bladder out. If you've got anything like a fluid restriction, that's very important to keep in mind as well. Because in those special circumstances, you really can't just drink and drink and drink. You have to be very mindful. So if your catheter is blocking and you are on something like a fluid restriction, we might need to think about, is it worth considering doing a bladder flush, where we actually put some fluid into the catheter and flush the catheter and let it drain out. It's much better to flush a catheter than it is to change the catheter, if it's well before when the catheter is due to be changed. So sometimes that's worth doing. So are you drinking enough water? Are you drinking appropriately? Do you have bladder spasms? And do you have any constipation going on? They're probably the top 3 things that I'd really want to question you for, to see if we can help with that.
So our next question is also one that I found really interesting, actually. But is it okay to use tampons, as I found they work well for my stress incontinence? I find other contraptions hard to insert.
Yeah, well, I would be making an assumption that if you've got a tampon that's reducing your stress incontinence, that it's possible you've got a little bit of a prolapse happening, and it's possibly minor. But what you would benefit from is an assessment with a really good physiotherapist who specializes in pelvic floor. And they will do an assessment for you. They'll do an external assessment, and they'll do a little bit of an internal assessment as well. These pelvic floor physiotherapists are great for men as well. So sometimes there's some male dysfunction with the pelvic floor. And I would encourage every man not to be afraid to go and approach a pelvic floor physiotherapist for an assessment, because they can make a huge difference in your symptoms as well. So if you're using a tampon for stress urinary incontinence, I'd say that's probably a good time to actually go and get a physiotherapist to give you a really good pelvic floor exam, or a urogynecologist as well for females. And they'll just assess what's happening with those three compartments: your bladder, your uterus, which is at the top of your vaginal vault, and your bowel as well. So having a good look at all of those and where they're sitting in your body will actually give them some indication as to why you might have that stress incontinence as well. So the pelvic floor exercises can go a long way to help with that, but there might be something a little bit more going on, like prolapsing, that we need to have a look at as well. Yeah.
So next question is, I wear pull-ups when I go out, especially on a long day. I've been doing this for a bit over a year. My question is, by wearing pull-ups, do they make things worse? As when I take them off at home, I start to wee straight away before I get to the toilet.
So we have this thing called key and lock syndrome. If you've ever been at the front door, you've been okay, you've been out for a couple of hours, you may have had a cup of coffee and maybe a glass of water at a friend's house. You get to the front door, you're feeling fine. All of a sudden, you get that key, you get to the lock, you put it in. All of a sudden, you find you're squashing your legs together, you're crossing your legs, and you hope your neighbors don't walk by because you look a bit funny doing some sort of weird bottom wiggle at the front door, clenching yourself together so you don't leak before you get into the house. And you get that key in, and then you're busting. You race down the hallway, and you might not even make it down the hallway. You might have a wee. That's what happens when our brain and our bladder talk to each other and the rest of us doesn't get a say in what's going on. So what we need to do is learn how to delay those urges that the bladder's giving us, how to delay our response to that. So if you're waiting for that urge to pass, it'll often go by, and you can go to the toilet and have a void on the second or third urge maybe. But it's that awful feeling of, I'm about to get to the toilet, I'm going to sit down to have a wee, and you can't quite make it in time. So if that's something that you're experiencing, this urgency, and this urge incontinence as well, which is when you leak when you have that urgency, I would suggest that you have a chat to your pelvic floor physiotherapist. Have a look at how much you can help to support your bladder with those pelvic floor muscles by helping them to tighten up a little bit, and you keep that urethra tube that you wee out of nice and tight when you need it to stay shut. And if that's all working well, when your bladder has a big spasm, it's more likely to be contained if you can keep your pelvic floor nice and tight. So that's definitely something to work towards. So wearing pull-ups doesn't necessarily make your incontinence worse. It's a little bit of a mind game in that you think, oh, I'm safe. If I leak, I'm all right. I've got a pad on. Mind over matter. As soon as you take that pad off, you think, oh, I'm going to embarrass myself everywhere. So that's something that's a good place to start, is have a conversation with someone about that sort of urgency that you get, and working on your pelvic floor to try and delay that rapid voiding that you get waiting for that first urge to go to delay. Yeah.
All right, and our final question for this topic is, what underwear is best to use with pads to counter mild bladder leaks?
Well, I would say whatever you feel most comfortable in.
Mm-hmm.
Really, if you find a pad that works for you, it's not too big and bulky, and it contains your amount of leakage, then wear whatever you like over the top. Makes you feel comfortable. Just making sure that your skin is able to breathe and you're not having any experiences of the dermatitis that can happen. So the best underwear, you can just wear normal underwear, or you can get some washable underwear that's highly absorbent as well. It comes down to your own personal preference.
All right. Another question we had was in relation to kind of sore skin and itchiness. So this one says, is an itchy vulva due to incontinence or menopause?
Oh, that's a good question as well. Well, it could be from both. And that's probably a good time to have an assessment with a urogynecologist. it might be another condition, another skin condition that's not to do with menopause or incontinence associated dermatitis. There is a condition that a lot of women don't know about, but it's really more common than you would think, called lichen sclerosis. And that's an autoimmune thing that happens. We don't as far as I'm aware, we don't really know why it happens, and it can be a little bit hard to get rid of. But sometimes using steroid creams to help can make things a little bit worse. If it's so an itchy vulva due to incontinence or menopause, we would say if it's incontinence related, it's probably more that you're getting a bit of that dermatitis and that burning from your urine that's wearing away that natural skin protection that you have. So you need to make sure you've got good pads on. We need to use products that protect your skin and help to clean your skin. If it's a menopause issue, we might be looking at a lack of estrogen in the tissue there. So it might be helpful for you to see a urogynecologist and start on some topical estrogen in conjunction with their advice. And estrogen can be a really helpful, very localized hormone therapy. It can be a really helpful product, and the side effects are quite minimal, and the argument for using it is really quite a productive one at the moment. Yeah.
So we also had a lot of questions come through in regards to urgency incontinence. So maybe we can talk a little bit more to what urgent incontinence is and what we can do to help it. So someone has asked, are there tricks for distracting urgency incontinence? I know scrunching toes can help. What other ones are there?
Yeah, sure. Well, urgency is what happens when your bladder's a bit unhappy and it has those contractions to try and get rid of what's in there. It lets you know that it's not comfortable and relaxed and just filling up at a nice slow pace. It's actually really quite interesting getting rid of what's in there. So we can have an urgency when those bladder contractions are very strong and hard, and we can have urinary incontinence, which is when we have that urgency and we try to get to the toilet, we can't get there in time. There's also another kind of incontinence, which is called functional incontinence, and that's more about, can you actually get to the toilet? Are you able to walk there at a reasonable pace, or are you quite slow? Or are you in a wheelchair and you have a lot of delay in getting to the bathroom and transferring onto a toilet? So those things come into play. If you've got urgency and you've also got a bit of functional deficit as well, that makes it a lot more tricky for you. So dealing with that. When it comes to dealing with this, yeah, sure. Well, urgency is what happens when your bladder's a bit unhappy and it has those contractions to try and get rid of what's in there. It lets you know that it's not comfortable and relaxed and just filling up at a nice slow pace. It's actually really quite interesting getting rid of what's in there. So we can have an urgency when those bladder contractions are very strong and hard, and we can have urinary incontinence, which is when we have that urgency and we try to get to the toilet, we can't get there in time. There's also another kind of incontinence, which is called functional incontinence, and that's more about, can you actually get to the toilet? Are you able to walk there at a reasonable pace, or are you quite slow? Or are you in a wheelchair and you have a lot of delay in getting to the bathroom and transferring onto a toilet? So those things come into play. If you've got urgency and you've also got a bit of functional deficit as well, that makes it a lot more tricky for you. So dealing with that. When it comes to dealing with this urgency incontinence that you have, it's very helpful to understand how the bladder works. So the bladder's got a lining on the inside, which is really quite sensitive, and the bladder is like one of our old friends who doesn't really like to change their ways very much. They just like what they like, which is pretty much water. So the things that irritate the lining of the bladder and make it want to squeeze to get rid of what's in there are things like tea, coffee, because they've got caffeine in them. So caffeine irritates the lining of the bladder. Soft drinks that have got caffeine in them as well. Mountain Dew, Coke, Pepsi, they have caffeine in them as well. Or if you drink those energy drinks, they've got a lot of caffeine too. Things that are carbonated, so fizzy drinks, anything that's fizzy, soda stream, that carbonation can irritate the lining of the bladder. Alcohol as well, even in small amounts. Smoking is also quite harmful for the bladder. And some medications and even some spicy foods or things that are very acidic, like if you like lots of lemons or you're a tomato fan, those things can make the bladder a bit overactive as well. There is actually quite a long list of bladder irritants. So they're the main culprits. Yep. So just having a bit of a mental check on how is my bladder performing and what have I been drinking or eating up until now. And that might help you to actually identify what some of those things are that your bladder's sensitive to. Yeah. So if your bladder's overactive, giving you that urgency to go, what can we do about it? So the question is about distracting, so tricks for distracting the urgency incontinence, and scrunching your toes can help. So what else can be helpful? So really that's about interrupting the signal to the brain from the bladder. So your bladder is connected with nerves like everything else in your body. And those nerves go from your bladder to your spine, up your spinal cord to your brain, and your brain processes that message and sends it back down again. So if we can interrupt that message that's going up to the brain by stimulating something else in your body, like scratching your nose or scrunching your toes or doing a pelvic floor squeeze, squeezing those muscles together, or maybe just scratching your leg up and down on your thigh, giving it a bit of a rub, that sends a different message to your brain. It's a different stimulus, and that can be helpful to do just to wait until that urge to go disappears, and then you can get yourself up, head to the toilet, and sit down and have a wee in a timely way. You might find that urge comes back a couple of times quite quickly. So that's what we call bladder retraining. It's teaching your body, teaching your bladder to wait a little bit until you're actually ready to go. So you be the boss of the bladder, not the boss is the, not the bladder is the boss of you.
Yeah. Yeah, wow, okay. Well, it's really interesting how connected the body is.
Oh, the body's a wonderful thing. Got to look after it.
So our next question that we have is, how do you approach the topic of sexual relationships when you have urge incontinence?
I hear you in this question. So I'd say my first initial reaction is be comfortable with yourself. If you can be comfortable with yourself, it's a lot easier for someone to be comfortable with you.
Yeah.
And sometimes that's just the reality of what you're living with. We all have our things.
Yeah.
And incontinence might be something that's a part of your journey. Talking to someone about it's probably the most helpful thing that you can do. Finding the right person, choosing the right person to talk to about it. Maybe not that neighbor who tells everybody your business, but actually picking somebody who really knows what they're talking about, has a listening ear, and is happy to take their time with you to really talk about what it feels like to be living with this. There are some really good clinicians out there, nurses and specialist doctors, and this is something they're very passionate about. Especially if you've got a history of some negative experiences as well in your sexual intimacy, in that history for you. Love yourself through it, tread gently, and find the right person to talk to, I'd say.
So now that we've run through urge incontinence a little bit, we also had a question about double incontinence and how to manage it. So I guess, what is the difference between urge incontinence and double incontinence, and how does one manage it differently?
Yeah, so double incontinence is what we would call incontinence of the bladder, but also incontinence of the bowel. They might happen at the same time, or they might happen at different points in time, or you might only have bowel incontinence with no bladder leakage. So understanding what it is probably the first thing, and then why it happens is probably the next most important thing. So why does a bladder tend to leak? And I think we've covered that a bit today. Yeah. Why does the bowel tend to leak? That's another question. Probably the specialist most helpful with that one is a really good gastroenterologist. You might need something like a colonoscopy where they actually have a look at what's going on inside the bowel. There might be something that's going on with the nerves connection the nerves connected to your bladder and your bowel, and that whole pathway up and down the spine to your brain and back. And it's it's a little bit strange, the amount of people that I say, oh, you've got bladder issues and bowel issues. Have you ever hurt your back? And they'll say, no, no. That's my bowel. It's an issue, not my back. Yes, I've got a sore back, but that's different. I'll say, oh, well, sometimes they're very closely related. So it can help to have a closer look at what's going on if you've got double incontinence. How can you manage it? Well, first thing is to have a really good pad, just so you've got the dignity and that security that if you go outside, it's going to contain it well. Having a pad that fits you properly is really important when you've got fecal incontinence as well. Bowel incontinence is a little bit trickier to manage because you've got the odor factor as well. And I think socially that can be there's a little bit more stigma around bowel incontinence as there is to bladder incontinence. So that can be hard. And often people, they might get to the point where they really don't want to leave home because these things are happening to them. And that's really not fair. Mm-hmm. And, we need to do our best to help you get to the point where you're living the best that you can with what's happening. But it's not stopping you from getting out there and living your life, because incontinence can really affect your mental health as well. So we need to stay on that journey with you. So having a great pad out there, we know that charcoal is a product for absorbing odors as well. So there are pads out there that have charcoal in them. You can also get washable, wearable products that can be really helpful. Making sure they fit you nice and snug as well.
And finally, for our video today, we are going to go through a few more questions that are more category specific, but are really interesting ones that, we wanted to address. So the first one is, how can I travel for 4 days with incontinence and not feel embarrassed?
Yeah, good question. Okay. So first one, I guess, is really to say, how comfortable are you with yourself? Because chances are you're traveling with somebody else who has incontinence as well. So we know that 1 in 4 Australians have some kind of urinary incontinence, 1 in 3 women and 1 in 10 men. In a crowd, you're not going to be the only one that's wearing an incontinence pad. Mm-hmm. Yeah. So being prepared, pack what you need, plan ahead. Yep. Make sure you've got enough with you. Sometimes airlines, I think they do make allowances for extra baggage if you're carrying things like medical equipment. So that can be a helpful thing to know and have a conversation about. Pack in a way that makes you feel comfortable about yourself as well. If you've got to take a lot of pads with you, wrap them up in something really pretty that you like to look at. If you've got to pack a whole separate suitcase of incontinence products, pack it in a hot pink suitcase if you want. Feel good about yourself going on a trip rather than going, oh, that's that bad. Celebrate that you're on a journey for yourself. So being prepared, having enough products, knowing where you're going, and a bit of foresight so that if you've got to get anything while you're there, you know where you're going to get it from.
Totally, for sure. Like, having everything prepared in advance is always a good feeling, and knowing that you're ready to go somewhere. You don't have to worry about anything else. We want to enjoy that trip. So our next one is, what is the best way to manage fecal incontinence when I'm out?
Okay, so first of all, let's work out what's going on with your body. Have that conversation and let's see what's going on in your bowel. So why have you got this fecal incontinence? There might be something that we need to do well before this conversation happens about how to manage it when you're out. That's, what's your diet like? Are you eating plenty of the right foods that are helping your stools to be nice and soft and easy to pass? Or is there quite a bit of constipation, or even constipation with overflow, which actually makes you feel like you're constipated one day, you're diarrhea the next day, you're back to constipated the other day, you don't know what's going on. That's when you need a bit of help to get through that stuff. So in terms of the best way to manage fecal incontinence when you're out, having a great pad, having products that you can rely on, so that you're not thinking the whole time you're out, oh my goodness, I'm about to have an accident. What am I going to do? Pack what you need with you, have seconds of everything, um, and know what works for you. So there was a product on the market a little while ago. It was a Coloplast product that was a peristine anal plug. It was a little bit like a tampon for the bottom, and that was quite helpful for people. But there was something to do with the registration of the product. I'm not really sure. I don't think it was deemed unsafe, but it was more of a sort of a policy thing. So that product isn't available anymore at the moment. There are a couple of other things on the market, but they're more for very light anal leakage. So there's nothing really great and reliable for that sort of fecal incontinence. There is something does a little bit more of the heavy lifting if you need it, and that's a whole nother conversation about transanal irrigation. So that's something that you set up with a specialist, and it's a whole new routine for you. But that can be really helpful if you've got ongoing daily bowel leakage and it's been going on for a while, and we haven't been able to get any answers. And your doctors are well aware of what's happening with you. That is something that could be considered down the track. The best way to manage when you're out and about is, prepare yourself before you leave home. Have everything you need. Have an emergency bag just in case, if you've got to rush out the door to something unexpected, that you've got something there that you can grab that's got a spare change of clothes in it for you, spare incontinence pads, lots of hygiene products for you as well. Yeah.
So the next one is I've been dealing with incontinence for over 10 years. It is worse in cold weather. Does climate or weather have anything to do with it? So very interesting question, something I've personally thought about before. So I'm really intrigued to hear
Yeah, it's
more.
interesting. I'm not sure there's much evidence out on that one, but anecdotally, definitely a thing. That's right. You know your body better than anyone else. I've had patients come into my clinic that have said that they'll have a glass of cold water and then they're just weeing and weeing, which is a funny one because by the time you wee it out, it's the same temperature as the rest of your body. So, there's a couple of little funny things our bodies do. But definitely it's a known thing that cold weather can make your bladder more overactive. There's probably a few reasons to that, but one of them is cold makes things shrink. We get colder. We maybe are less likely to drink lots of water than when it's a warmer weather. So maybe you're actually underhydrating, which is making your bladder a bit crankier, which makes it actually wee a bit more often. So just being mindful of what the good habits are, that might be something to actually consider.
Wow, okay, cool. Very interesting to learn. And then our final question for our video is it worth going to see a continence nurse if I'm in my 20s and have continence issues?
Absolutely. I see people from, probably 2 is about the earliest I see them in my clinic until 92 or over. So never too young, never too old. If it's an issue, come and talk about it.
Always super important to get checked and get help if you need it, no matter your age. So, yeah, definitely. So that is all for part one of our session. Thanks, Rachel, for joining us and helping us get more clarity on different questions and different situations, and for all of your amazing advice that you've given us today. And yeah, I've personally definitely learned a lot more after this. And I hope everyone watching has learned a lot more too. Thanks again so much for watching, and we will see you in part two. We'll see ya.